This is a 33-year-old male with a history of left-sided unilateral cleft lip and palate. You can see his facial, nasal, and dental deformities associated with this. On smiling, you can see the rotation, malrotation, crowding, spacing, class 3 occlusion, irregularities related to the occlusion, presence of a fistula, lack of eruption of canine tooth. Here on the cone beam CT, you can see that fistula. You can see presurgical orthodontics have been applied now, but that canine is still impacted and in the line of the fistula. We plan orthognathic surgery, segmental, to be able to correct the position spatially, vertically, sagittally, closing this fistula all at once, as well as removal of that canine. You can see on the 3D plan how we've established a nice arch form by collapsing those segments at the level of the fistula, closing the fistula, bone grafting it, and establishing a good arch form in addition to sagittal relationship. Now, pre and post-operatively, we can appreciate the difference on cone beam CT, the amount of maxillary advancement, mandibular repositioning, change of the occlusal plane, and rhinoplasty. The 3D image shows this too with better lip balance and midfacial support. He still does have a nasal deformity, which we will address in a staged fashion 3 months or so later. This is him subnasally. You can still see that that septum is over into the right nostril. He has poor nasal tip support. But look at this occlusion. This is his post-op occlusion. That fistula has been closed, canine substitution. He has good buccolingual anterior-posterior relationships. 3 months later, we go back and we're able to perform a septal rhinoplasty in the cleft variety. A composite graft is taken as well as a number of other grafts to achieve tip support, super tip break, alar rim grafting, as well as a composite graft from the right side to the left side. Here he is following that on frontal view, 3/4 view, the new position of the nasal tip, the improved dorsal position, the tip to dorsal relationship, the nasolabial angle, alar columellar relationship, position of the lip, overall facial balance. Here on left lateral again, improvement of the nasal, facial, occlusal, alveolar fistula aspects. Here's a close-up lateral view on the left-hand side. This brings it together in the 3D rotating view. A cleft patient with cleft orthognathic surgery where we collapse the segments, remove an impacted tooth, graft the area, close the fistula, achieve facial harmony, occlusal optimization, and then come back for nasolabial optimization as well with a septal rhinoplasty. So thanks for listening. If you have any other questions, please check us out on our website, www.derricksteinbacher.com. Thanks again.